If you or a loved one has ever stayed in a hospital, you may recognize some of this medical equipment. After a hospital stay, perfectly good, sterile equipment is often thrown away, even though it's still new and usable. But because of a big idea, it's now brought here to the Partners for World Health, where it's sent throughout the world.
It's always a big wow when they walk in because they're totally amazed that everything in here was on its way to the dump. So now we make sure that none of this stuff is going to go to the dump, that this is all going to be recycled and given to people who need it in the third world.
Partners for World Health recovers useful medical supplies that U.S. hospitals must discard due to government regulations and distributes them to organizations and people around the world. They are one of very few agencies of its kind in the country, the only one in New England. How did this all get started?
Well, I'm a nurse and I used to live in the Middle East, and part of my job was to travel to different parts of the world to do healthcare recruiting and also to do assessments of hospitals and facilities, and I would always carry a bag of medical supplies because when I was there I found organizations that didn't have anything on their shelves. So I would fill up a bag of medical supplies and take off and go to these different places, and sometimes not even knowing where I was going to visit, and drop off a bag here and there. And because I want to make a difference in other people's lives, I decided, well, I'm just going to collect this a little bit on my own, and I'll just go out and do it by myself. Every time I go to Ethiopia or Vietnam or Cambodia, I'll just pack up my bags and take a few with me. And then what happened is that it started to grow. And that was when we first moved to our first warehouse on Marginal Way. And we weighed everything that came out of my house so that we knew that it was close to 11,000 pounds. And we created this huge pile, this huge mountain of medical supplies in the driveway.
Today, Partners for World Health is in more than 25 hospitals in the state of Maine and a handful of others in New England. They stock several warehouses full of materials and have an astounding turnover rate. In addition to creating a huge environmental impact, Partners for World Health seeks to lower the cost of healthcare by taking away the unused supplies for free, doing away with the high fees hospitals pay to have the materials removed by a medical waste company.
There's so much material here that has been earmarked to be discarded, and Partners has come in to take this material to send it to places where it can be vitally used. There's so many places in this world that are just hungry for help.
Trips are planned to deliver the highly demanded items from bandages to beds to patients throughout the world.
The medical supplies are always accepted with open arms in the third world. Some of the hospitals in Sierra Leone, for example, in Africa, some of the facilities in Tanzania, there are so many facilities throughout the world. Their hospitals in their storerooms have nothing compared to what's in this warehouse. What you see in this warehouse is one example as to why our healthcare is so expensive. Everything in here, some hospital or someone paid for it.
And why can't it be used here, I guess is the question that most people would be asking.
There are a lot of reasons in our healthcare system that say that once it's out of the clean utility room and it's in a patient's room, it cannot be brought back into the clean utility room. Now, there are ways within facilities that they could clean off a package, but that's also a cost issue. There's also concern about infection control. But when you have a dressing that's in a package and the package hasn't been opened, that dressing inside that package is still sterile. So we need to think about how we're doing our work in facilities because our healthcare system is too expensive.
Partners for World Health is run entirely by volunteers. Shipping and operation costs are paid for by donations, grants, and fundraisers. To sort through a pile this high, made larger every day, requires a lot of ongoing help.
There is a great need for volunteers. There's a staggering pile of material, and that just shows the need for volunteers to come in.
The world is so complicated now, and there's a lot of bad vibes going on between a lot of people in Congress and things like that, and I like being able just to focus on something where I can really see the practicality of it and that something's actually being accomplished that's helpful to others.
It's a very satisfying endeavor.
This is my end-of-life mission. This is it. I am going out with this one. When you believe in something, you figure it out. And that's one thing that nurses learn when they're in nursing school are 3 words: figure it out. And that's what we tell everybody here that comes through the door. We can figure this out. This may look like a huge pile, and everybody may wonder, is it really going to go anywhere? But I promise you it will be going, and it's going to make a difference to millions of people in the world.
Want more information about Partners for World Health? Log on to their website, partnersforworldhealth.org, or there's a link on myfoxmaine.com.